discussing digital health and the latest trends.
Good afternoon, I am Jessica Shkembri-Higgins, a higher specialist trainee in general surgery, and I'm very pleased to be moderating this panel. I invite all the panelists to join us here. Unfortunately, Mr. Karwana Dingley could not make it this afternoon to pressing family matters, and instead Ms. Rachel Abela, who is the Deputy Chairperson of our department, will be joining us instead. I would like to invite you all to give us a brief introduction and a little background about yourselves.
Are you hearing me? Yes. I'm Rachel Abela. I'm currently Deputy Clinical Chair in Malta Day of Surgery, Deputy of Surgery. I just closed the third year of actually working in Malta Day. Prior to this, I was working in Gozo General Hospital for 9.5 years, and this follows my returning to Malta from about 8.5 years of specialist training in the UK.
I'm Bejan. Everybody knows me like this. Bejan Drevic, and I am a surgeon, general end, colorectal surgeon, and educator in laparoscopic surgery at the European Association of Endoscopic Surgeons.
Good afternoon, I'm Jeffrey Dully. I'm a multi-strain general surgeon. I'm currently an oncoplastic fellow in Sheffield. I have a research interest in surgical AI, and for the past 3 years I've been working on a funded research project, large collaboration in Ireland.
Good afternoon, I'm Joshua De Caro. I'm the only non-surgeon on the panel. I'm a physiotherapist and I'm a senior lecturer at the University of Malta in the Department of Physiotherapy.
I'm Ferdinand Soracina-Inglot. I'm a vascular surgeon based in Manchester. My main area of specialty is fixing complex aneurysms using minimally invasively techniques. Thank you.
Hi, thank you all. So first off, I would like to start by unwrapping the term digital health. So what is digital health? Digital health is used for the use of technology and communication systems applied to medicine and other healthcare professions to manage illnesses, health risk factors, and also to improve well-being. So, Ms. Abela, as Deputy Chairperson, can you tell us why digital health is so problematic to apply to the current department, and what has stopped us so far in achieving this and adopting this in our daily lives? How can we make this part of our own training?
Well, I can't say that we have not already adopted quite a lot of aspects of digital health in our hospital. However, if we go back historically, Malta, in the practice and adoption of a lot of clinical and non-clinical efforts, there's always a time lag, and we tend to learn from others' mistakes, which is an advantage because we see the ready product and can already test it and we get there. However, in the case of IT and digital health, this didn't quite happen that way. You're talking about a population of people that are intelligent, that already have their likes and dislikes in the way they implement and do things. So we ended up with a fragmented collection of digital appliances. As in, we've got iSoft, we've got CTMS, we've got the cardiovascular system. So a lot of people were quite eager to get their own little area organized and computerized and digitalized. And we have a lot of factions that are not communicating with each other. In the ideal world, we should have an efficient, interactive system that involves all stakeholders, both the users and the beneficiaries, and it should be inclusive of all our services and also have the capacity to change and evolve. And we're not quite near there. However, the development of the IT department in the health department is changing, and they are actually involving the stakeholders more. And I'm hoping that slowly we'll have a task force that will actually address all the different aspects, an inclusive task force, but The most important thing is for us to be able to start with a vision of what we want from our health services and where we are going, because what we start today will be rolled out a couple of months, a couple of years down the line. So we need to think ahead and to try to imagine or project, really, from population studies and changes and healthcare changes, what we need our system to do.
Thank you for that insight. Definitely a centralized system will be much more efficient and also user-friendly and will be easier to adopt. So, Prof. Saracino Glot, you have experienced digital health, you have used it in your daily life, in your work and in your surgery. What is your personal experience, and do you feel that this has actually improved your outcomes?
So my experience in digital health from a vascular surgeon, as I've shown in my talk, is to aid planning cases and performing cases safer. As a clinician also, around a year and a half ago, our hospital moved completely paper-free, so we moved to a completely electronic patient record. So I've seen the advantages and also problems of that as well. So in terms of talking surgical and technology, I think clinical trials, as we heard in talks earlier today, are really important to show that a new digital health solution really works rather than being a fancy toy. So for example, we are now able to get very nice 3D reconstructions of the aneurysms we're fixing on our fluoroscopy, means the X-ray, on our X-ray screen. However, they're not always accurate. So the biggest change recently, the product we're trying is called SIDAR, is that rather than just taking the image and putting it there, what it does, it uses cloud technology to position the picture of the aneurysm based on the patient's vertebra, but it also uses artificial prediction technology to predict how the aorta changes. Because when we put these wires in the main artery, the shape and position of those vessels changes. So if you just had to get a 3D impression from the CT scan and put it there, it may match when you first put it there, but the moment you put these stiff wires to introduce your stent, it may not match. So that's one of the helpful things. Now, whether that will really change practice, whether that will really make the operation safer, faster, more efficient, we don't know.
Well, certainly I believe it has provided you with a shift towards a more patient-centered approach and a personalized approach to surgery as well. Mr. Dalney, you've done a lot of work with digital health and you're an innovator yourself. What were the challenges that you had to overcome in doing so?
Yes, that's a good question. It's a transition from being a surgeon, a doctor, or any other patient-facing specialty like Dr. DeCaro, moving into a field which is very technical, very mathematical. Our education system, as with anywhere in the Western world, gears us towards our life sciences, biology and chemistry. And now trying to deconstruct all my learnings and started to think like someone who studies maths, who studies computer science, and these things is very difficult. I think the opportunities are there. So as I said in my talk, it has become easier for us surgeons now to start using these digital tools and to create apps and to create AI. And I've met many innovators here who have startups where they've built their first app and they're already marketing it. So the threshold of moving from idea to something either research grade or usable has become much lower. So I think my personal experience has taught me about that we need to now introduce digital education as an important role in undergraduate medical education, and that I think repeats what was said on the previous panel.
Thank you for that. So we've been taught to think about the patient holistically, in a holistic manner. And we cannot talk about the patient and talk about the comorbidities without looking also at the social aspect of the patient and the social risk factors. Mr. Andreevich, how do you think that digital health and AI can actually help us in identifying those patients with those social risk factors and in improving our care for them?
Thank you, Jessica. I think it is an important question, and I believe it comes out with the paper we wrote together. Just briefly saying that after any surgical intervention, actually the patient do recover maybe physically well, but then psychology takes about almost a year to recover. And it is very important to monitor these people once they're at home. Especially we have an elderly patients, and we know that the actual population next year will, the population over 85 will double the age of people who are 15. So a growing number of elderly people. And I was thinking on the way Jeffrey said, on artificial intelligence. So we have our data, we have guidance, everything, but nothing is put in one tool, artificial tool, when we'll collect all this data, analyze the data, and actually give a primary physician an idea whose patient suffers. So whether they will be predisposed for infection, like chest infection, whether they come to see you in your clinic. So this data, artificial data, would probably analyze their behavior from home and their medical records and alert you, say, hey, listen, this man is prone to falls, or this man is prone to having a chest infection. Look at that before you come in. So I think the home-based data collection put in an artificial intelligence tool will be the future.
Yeah, agreed. Even something simple, such as recording the data when the patients are missing appointments, when the patients are missing the investigations that you've booked for them. I think it can actually highlight those patients who are not accessing care, which can lead us to investigate and question, why is this patient not turning up? Why is this patient missing appointments?
No,
highlighting those in vulnerable
that is
groups.
Exactly.
And actually allowing us to intervene. So we're all here quite very keen to adapt to digital health, and we're all quite positive that this will help our patients. But what about the more negative side effects? What if not everyone can catch up to it? Dr. Sherry De Caro, we've heard being mentioned the digital divide. What do you think about this, and how can we mitigate this?
I think that's an excellent question, an excellent point to ponder about with digital health. In fact, you cannot talk about digital health without recognizing issues about access to digital health, not only for the person, the patient, to be able to access these devices, but also for members of the multidisciplinary team to access data related to the patient. And who owns that data, and how is that data going to be shared in a timely manner. So we already experience currently, for example, that there is quite a good level of digital health factors, processes in Malta, with My Health, for example, but it's not easy for all health professionals to access that data, especially if you're not necessarily within the public health system, so if you're operating only in a private system. So these are some of the issues that would need to be seen to. Another aspect would be compliance. So digital health is as good as you use it. One would need to assess that it is being used purposefully for the methods and means that it is intended to be used. And if it's not used correctly, then it could be giving you the wrong feedback and leading you in the wrong direction. Yesterday there was a talk as well about the ethics involved around digital health, and that also brought about some of the negative sort of sides that one needs to know about them to be able to deal with them. So I think that we've moved strides with regards to digital health, but we still have to understand better how to interact with it in the future.
I am glad that you've mentioned that, actually, because one of the issues in implementing digital health is that patients may be a bit reluctant to trust us with that data, because if we're gathering all this data, we have all these parameters about every little aspect of their lives, their social parameters as well as their physical parameters. Some patients may actually be afraid of where the data is being stored and what the data is being used for. So I think data ownership and patient consent, protection of the vulnerable groups, And being ethical and professional in our gathering and management of this data is also very important. So, and I will ask this question to the panel, feel free to answer. Where do you see digital health going in the future? What can we look forward to?
If I can say something, as is the general theme of this whole event, the way forward is this holistic approach. So we're dealing with a more elderly population, a population which is, as we say, less digitally tech savvy, yet it's a population that can gain the most from all these technologies. We have now multiple parameters which we as patient-facing specialists have to approach, but we were all trained within our specific focus. We surgeons, for example, are very technically focused on operation, but the recovery, as Mr. Andreevich said, is a lot more complex. Patients can fall at home. Patients can, not access enough nutrition. So, what these tools, which can take all these inputs, can give us back to us individual specialists in our field, is a holistic picture, and help us approach these elderly patients with much more information that we would individually have access to.
Thank you. Ms. Sabela?
I would like to see a system that integrates more our services on multiple levels. We can look at data processing, we can look at workflow, which is one of the big problems in our local hospital. We can also look at the potential to research and elevating the image of our hospital and our performance and outcome data. There may be a reluctance initially for us to expose ourselves. A reluctance to have our data is especially when we refer to performance data in cases of both medics and most particularly interventionists and surgeons. There is the scope of things like the league tables that are evident right through the UK, and when the hospital is required actually to show how good they are and how good their constituents are, their services are. These are a lot of very big challenges and actually require massive culture change right across our medical community, be it from the management, consultants, junior doctors, students, the whole cabal.
Thank you.
I think that at this stage the industries is one which are going to pull through everything. We have the data, we have our things which are prepared, but somebody has to put them together and produce. The financial issue is probably the most, but as long as the industry works hand in hand with the physicians, we should see it very soon coming in.
Yes, Prof?
Yeah, so I think one of the great things you mustn't forget about digital health is that it gets patients more involved. So we live in a digital world. We all got iPhones or whatever, smartphones, smart watches. So people are much more conscious about their health. And one of the things we've seen, so with our electronic patient system in Manchester, we've got something called MyMFT. MFT is the initials for our trust. Where the patient can log in and have an account, and unless you click on something for the patient not to see it, this is the scary bit, is they can see all their notes there in real time. And with vascular patients, we've got quite an elderly group, and I thought people will not use it, but what we've seen is much better involvement in patients becoming more knowledgeable about their health and more, so to say, involved in their healthcare. So I think that's a big plus of digital health, is that people are more aware and more conscious.
So the patient has become a player in managing their own health, rather than just being the victim of diseases. The patient has become a major player. Yes?
You asked where do we see it going. I think that the future is within digitalization and digital health, and we have a responsibility as the educated part of the spectrum, if you like to say that, to move and embrace the progress. Mr. Dali mentioned the fourth industrial revolution, and this has been here now for more than 10 years. So we have a big responsibility to embrace change and to move ahead with the change, because at the end of the day, this is only going to be good for our future generations, and we should not be the ones held accountable for holding progress in moving forward. So I think that it's not here to stay, it is here, and it is here to be used.
So I agree with you completely. We do not only have the responsibility, but also the duty as healthcare professionals to raise the bar, to improve outcomes. As the Honourable Minister, Dr. Joetta Nabella, said earlier on today, we are the older persons of tomorrow. So in doing so, in raising the bar, we are not only indulging in an altruistic endeavor, but it is also a necessary endeavor, because in doing so, we are actually ensuring our own personal future well-being. Thank you so much for your input. Thank you for these insights. We wish you all a very pleasant afternoon. It's been a pleasure. Thank you.